Hi everyone, welcome to Ask the Insider. We're going to get started here in just a moment. Welcome. Give me some hearts here, waves. Hi Jackie. Great, we got a bunch of guests joining us. Our expert guest here in a moment.
Hi.
Hi everyone. Great. Everyone's here. We're getting lots of love already. So excited to kick off this episode of Ask the Insider. Happy Food Allergy Awareness Month to everyone out there. Thank you so much for tuning in today. I'm your host, Becky Rosenberger, otherwise known as one of the insiders. My background is I'm a practicing physician assistant, predominantly in allergy for the past 20 years, as well as Associate Director of Clinical Affairs and Education at Thermo Fisher. I am really excited to have a special guest with us today who I will have her introduce herself in a moment. But I also want to let everybody know that we have a new and exciting opportunity to stay tuned until the end of our broadcast today, because we are actually have a giveaway. And so in partnership with Solid Starts later on in this discussion, we're going to have more details about what the giveaway is, how you can access it, so stay tuned for that. But right now, I'd love to introduce to you our guest, Dr. Bajawala, who is representing herself on behalf of the Solid Starts team. So I'd love to turn it over to her for an introduction. And why don't you tell us a little bit about yourself?
Hi, Becky. Thanks so much for having me today. My name is Sakina Bajwala. I'm a board-certified pediatric and adult allergist and immunologist. I'm in private practice in the suburbs of Chicago, and my clinical focus is on the prevention, identification, and management of food allergy in children. I'm also a member of the senior leadership team at Solid Starts, and that's the capacity in which I'm joining you all today.
Excellent. Well, thank you so much for taking time out of your busy schedule to join us. And our focus today is really around the early introduction of peanut. So something that I know you're very familiar with and really probably warrants a little bit of a walk down memory lane and a little history as far as how did we get here? What does early introduction even mean? I know we're getting a lot of comments already in the chat there, so I will be sure to get to those as well. But why don't you tell us a little bit around what is early introduction of foods? What does that mean?
Right. So the way we define the early introduction of common food allergens is the introduction of these allergens into the diet and a maintenance of these allergens in the diet consistently anytime after the age at which a baby can start to consume solids, at which it's developmentally appropriate for them to begin consuming solids. This is in contrast to advice that we used to give as medical professionals to parents years ago, like a decade ago even, that the introduction of common food allergens should be delayed with the intention of decreasing the risk of developing a food allergy. And as we'll discuss later on today, we've learned through emerging evidence that that advice may have actually been counterproductive. So now we have shifted gears and shifted direction, and our new advice is not to delay the introduction of common food allergens into the diet. So really, 4 to 6 months is what's considered early introduction. But the standard introduction for most babies, we're saying 6 months onwards.
Right, and we are really focused around peanut. The most research with early introduction and clinical studies has really been done with peanut, um, lasting over several years. And I was in the same camp. We were telling patients, no, withhold, these foods, especially peanuts and tree nuts, we were saying even until 3 years of age. So quite a
Exactly.
now to be talking about early introduction in that 4 to 6 month window. And early introduction is really around prevention of food allergy, which is different than someone that may have had a food and now has developed symptoms when they eat the food. Very different, right? Now you're having, an acute reaction, and it warrants a different approach. So we're going to focus our conversation today really around that early introduction because of prevention. So
Exactly.
any time in medicine that we can prevent something from happening, it really can make a significant positive impact on the patients. Can you talk a little bit about how you speak to your patients around early introduction and how important it is to prevention?
Sure. And I think it's an important distinction that you made, because I can't emphasize enough that if your baby has already exhibited signs or symptoms of experiencing an allergic reaction after ingestion of peanut, early introduction is no longer an option for prevention. At that point, the medical guidance would be strict avoidance until and unless your allergist believes that your child is a candidate for food allergen desensitization. So right now, what we're talking about is not about babies who already have an allergy. We're talking about babies who don't have an allergy, and we're discussing the introduction of common food allergens such as peanut into the diet early on so that we can prevent an allergy from developing in the first place. And that's kind of how I explain it to families, that when we are consuming foods and ingesting them through our GI tract, we can develop tolerance to foods, especially and most likely if we continue to consume those foods on a regular basis for an extended period of time. That's how we get the full benefit of early introduction. So I like to sit down and strategize with the parents of children in my practice of how we're going to go about introducing peanut into the diet so that we can prevent peanut allergy if it is at all possible.
Absolutely. Prevention is key. Sometimes we have patients that come in and it may seem like they do have some sort of symptoms. Maybe it's eczema, or they say, I had a rash one time. And it can be hard to say, did they have symptoms associated with a food or not? And that's really the place where testing can play an important part so that you can help to differentiate. Is this a situation that I need to be aware of a potential food allergy? Or am I looking at someone that does not have food allergies and now we want to go into that early introduction? So really a place where those diagnostic tests can certainly come in and play a part and help us in that decision making, along with having those conversations with the parents for sure. So can you tell me a little bit around once you get to the point where you are talking about early introduction? So again, patient that doesn't have symptoms, we want to try to prevent peanut allergy. Now we're getting ready to talk about that. Are the parents afraid? Are the kids afraid? How do you enter into that? Because it can be really nerve-wracking for patients and their families.
Yeah, well, I'll say that the kids are not afraid. They're babies. They're not afraid of anything. It's the parents. The parents are terrified, especially if there is already a sibling with a history of food allergy. This can engender a lot of parental anxiety. if you're the parent of a child with food allergy and you yourself have witnessed your child develop an acute allergic reaction or, God forbid, anaphylaxis, you are understandably traumatized by that. And that can lead to an incredible amount of anxiety and potentially reluctance when it comes to introducing another child or that child's sibling to peanut early on in life. Even though we know that having a sibling with peanut allergy does not create a situation in which a younger child cannot successfully pursue the early introduction of peanut, but parents are understandably concerned. And so those are the scenarios when we have either a child who is considered to be at high risk for the development of peanut allergy, and I'm going to take a pause to explain how we define high risk in these babies. And this is going to shift with time, but the current definition of a baby who is at high risk for the development of food allergy is a baby who either has severe eczema or already has a pre-existing egg allergy. That's what a lot of the studies were based on when we were exploring the efficacy and the safety of early introduction of peanuts. So if you have a child with either of those two conditions, then we will consider that baby to be at increased risk for the development of peanut allergy. And it is in these babies that the early introduction of peanut stands to have the most benefit, the most preventive benefit. So those are the babies we want to catch right away and get them into the clinic so we can determine if we can safely introduce peanut into their diets early on. So generally, 4 to 6 months. I tend to push it a little bit more towards 6 months because they tend to do better with their oromotor skills at that age. But we can do it anytime between 4 to 6 months. And in those babies, there's 3 forms of diagnostics that we can consider. The gold standard for the determination of the presence of a peanut allergy is an oral food challenge. So an oral food challenge is actually a diagnostic test that is done in the clinic in which a baby or a child will be fed peanut, incrementally increasing amounts of peanut, beginning with a tiny, tiny dose and gradually increasing every few minutes as long as the prior dose is well tolerated. And that occurs over the course of a few hours until the baby eats a substantial portion of peanut. And then after that, the baby is observed for another hour or so to ensure that there's no allergic reaction. And if all is well, now we have established that that baby tolerates peanut, and the recommendation would be to maintain peanut in the diet long term over an extended period of time. And when I say extended period of time, I mean years. Now, that is, like I said, the gold standard. But as you can imagine from my explanation of how this works, it is a time-consuming process. It is not something that in a high-risk infant would be done at home. It would be done under medical supervision at the allergist's office. It can occasionally be challenging to get those appointments in a timely fashion during that ideal window of introduction. And for some parents, it might cause a lot of anxiety. The thought of, oh, wait, you're telling me that I'm going to take my potentially high-risk infant and go straight into feeding them peanut? Are you kidding? Right? And so we have other options as well. We have skin testing. So skin testing is when you take a purified peanut extract and it is gently poked into the surface of the skin. Generally in a baby, it's going to be on their back, and just like a little prick, not drawing blood, not a deep puncture, just a scratch test on the surface of the skin. And that is compared to a positive control of histamine and a negative control of some buffered salt water. And you put the prick on the back and you wait for around 15 to 20 minutes and then evaluate the size of any swelling or redness at the site of the prick. And if the swelling and redness at the peanut site is significantly larger than that of the negative control or buffered saltwater site, we will have established that that baby is what we call sensitized to peanut. Now, what does it mean to be sensitized? That doesn't mean that you're allergic. That means that in your child's body, there is some evidence that they have developed allergic antibodies against the protein in peanut, which has caused the skin test to swell up a little bit, like a little mosquito bite. But of those babies that skin test positive, not all of them have peanut allergy. Some of them may have peanut allergy, and some of them may not. Some of them may be sensitized on their skin test, but may actually be able to tolerate the ingestion of peanut. And if they can, why wouldn't we want to keep feeding them peanut?
And those
Right?
those antibodies that you described, those are the same antibodies that are measured on a blood test. And it's this
Exactly.
thing. You can be sensitized, but you have to have those symptoms on exposure to truly have that clinical allergy. Important to distinguish, certainly, before you're going to go down that route of early introduction.
Exactly. So if you have a child with either the family doesn't feel comfortable going directly to oral challenge, or we do a skin test and it's not negative, in which case, if the skin test is negative, you can feel very comfortable either going to oral challenge or even home-based introduction of peanut in that baby. But if the skin test is positive, or for whatever reason the baby is not a good candidate for skin test, perhaps they have very severe eczema, and their skin is so inflamed that we can't get a good clean patch of skin on which to perform a skin test, then we may wish to go to a blood test. And in a blood test, what we're doing is we're trying to measure the concentration of allergic antibody or IgE antibody in that baby's blood that is specific for peanut. And we can further break that test down into something called component testing. And in component testing, we can quantify the concentration of allergic antibody against specific proteins within the peanut. Some of those proteins are associated with a statistically higher risk of developing a serious reaction to peanut after ingestion, whereas others of those proteins are more likely to be associated with relatively mild symptoms and are less likely to be associated with a serious life-threatening reaction. So this type of testing, this blood test, can be very illustrative, either in cases where you cannot get an allergist appointment very quickly, so you don't have the opportunity to pursue an oral challenge within that window in which we would like to, or there is some parental or provider even anxiety about pursuing an oral challenge, or a skin test is not a possibility due to the condition of the baby's skin, or perhaps they are on medications that suppress skin test results, such as antihistamines, or in a case where perhaps the skin test is positive, and prior to pursuing an oral challenge, the clinical team feels that it would be best to get some additional information.
Great information. So one of the things that we talked about before, and it's coming up in some of the comments and chats here, is really the differing opinions that patients and their families may get from varying healthcare providers. We know that this information around early introduction to peanut has been out for quite some time, but it hasn't necessarily fully penetrated into all of the healthcare arenas. Um, why do you think that's the case, and what can we do about it? What can patients and families do about it to help get the most accurate information?
Sure. I think it's important to recognize that, there's multiple different medical specialties. And in the more general medical specialties like internal medicine, family practice, pediatrics, they're expected to keep up with the up-to-date information on a variety of fields. And in the specialties, we are expected to pretty much know everything about one thing, right? Our narrow little box. And so generally, for these recommendations, they will start within the specialties. They will get established with specialty-specific research. The specialties will come out with clinical recommendations or consensus statements, and then that information will filter out to the general medical community and become kind of standard of care and standard practice. And so it's really quite normal for somebody who deals with food allergy on a day in, day out basis to have access to the most recent guidelines right away. And so if you're in a situation where you believe your baby may be at high risk for the development of peanut allergy, and the advice you are being given is, oh, you really should wait until 3 years of age to introduce peanut. The truth is that that is outdated advice. Now, that doesn't mean you have a bad pediatrician or a bad family doctor. I mean, these are great doctors who are really keeping up with hundreds of clinical guidelines. But it's reasonable to say, I'm really concerned about the risk of my child developing a peanut allergy, given that he has severe eczema or that she has already developed hives after eating scrambled egg. And you can, blame me. Say I was listening to this interview online and there was a pediatric allergist who said that early introduction of peanut in high-risk babies might help to prevent peanut allergy. And in some cases, it can prevent it by 80%. Do you have any feelings about that? And if you're not sure, would you be willing to refer me to a pediatric allergist who I could talk to about this? And I think that the vast majority of primary care physicians will be very receptive to that approach. But you'll find more and more that your pediatricians are going to be right on the money when it comes to early introduction. It has filtered out. This is kind of much standard of care now.
Certainly. And I know we have great resources online at Allergy Insider and certainly at Solid Starts to help with some of those conversations and answer some of the questions. So we do have a great question that came up in the chat here. So the question is really around if you are introducing peanut into the diet of an infant and they're also breastfeeding. What are the thoughts about having peanuts in mom's diet? Good? Does it make a difference? If so, how much? And what are your thoughts really on, the supplementing with the breastfeeding and how early introduction may or may not impact that?
We always support breastfeeding. But the truth of the matter is that we do not have enough data at this time to either advocate for or against any role for the exposure through breast milk. And so that means we don't really have enough data to say that it helps or that it doesn't help. So our recommendation at this time is mom should eat whatever she wants. And if mom's not allergic to it, then she can eat it. Certainly, there is no evidence to suggest that moms who take peanut out of their diet during breastfeeding do anything to prevent peanut allergy. And on the other side of the coin, there's insufficient evidence to suggest that deliberately loading up on peanut is going to expose your baby to enough peanut so that you don't have to feed them peanut directly.
Excellent. And I know we talked before that there is, there's a number of ways to appropriately introduce peanut, right? We're not going to get into all of the products and how to do it today. We don't have enough time. I would love to, but we don't have enough time. Are there any just overarching thoughts or comments that you have around what that early introduction could or should look like? I know you said, put it in the diet, keep it in the diet, do it for an extended period of time. Is there anything else that you would add to that?
Don't give your baby an actual peanut. It's a choking hazard. So that's not what we're going to do. We're not going to put peanuts or peanut M&Ms in front of the baby. Nuts are choking hazards. And so we need to use a formulation of the peanut that is age appropriate for the baby who's eating it. So that could be peanut butter that has been thinned out. And when you're doing peanut butter, try to do a natural peanut butter without a lot of added sugar or additives. We're going to thin it out because peanut butter has a very thick and sticky consistency. And so in the mouth of a baby, it can cause like cotton mouth and gagging a little bit. So we don't want to do that. We want to thin it out and then mix it into something that the baby is already successfully eating. That could be any sort of semi-solid, like applesauce, oatmeal, another baby cereal. If they're already having yogurt, you could mix it into yogurt, and any of those things would be perfectly fine. It's also acceptable the very first time you introduce peanut to just dip your finger in it and let baby lick it off your finger. That's fine too. That's not going to give them a lot of exposure, but at the very beginning, if you're just trying to get it in, that's perfectly fine. You could use a peanut butter powder. That's like a defatted pulverized peanut flour, and sprinkle that on top of food or in food that baby is eating. There are other peanut puff products that are available on the market that baby can gum on, or you can mix with breast milk or formula or a little bit of water and kind of mash them up into almost a baby cereal consistency and give those. So there's lots of ways to safely introduce. And if you go to the CDC or Center for Disease Control's website, there are instructions on how to introduce peanut for babies. And if you would like to go to Solid Start's website, we also have resources available on how to introduce allergens to babies.
Excellent. That's a really good segue for me to talk about the giveaway. I kept everyone waiting for a little bit here. So our latest Instagram Live has a giveaway in partnership with Solid Starts. So we are giving one lucky winner the Solid Starts bundle. I'll have you talk about that in a minute, but it's really that all access to the guides, videos, recipes on starting solids. So we gave you a little taste, no pun intended there, a little taste of how to introduce solids, but this is certainly a great giveaway. And access to those guides never expire, so you have access all of the time. And all we need you to do is follow the instructions on the latest post to enter for the giveaway before it's too late. Dr. Bajwala, do you have anything to add on the Solid Starts bundle and helpful?
Well, what I will say is that's like a really fantastic prize. It has so much information in it. I think it's great. So if you win it, you'll be very happy. And if you don't, you can still get it. You can go online and get it. So it's a lot of really good vetted information. So we have a great team of feeding specialists and physicians and nurse practitioners, speech language pathologists, dietitians who all review all of this information. So everything we're putting out there is evidence-based, and that's really important to us.
I'm just looking through the comments and questions here to see what we might have some time to address. I know there's a lot of really great questions in here, and some comments. So I will just say, as you mentioned, Solid Starts, great place for additional information. Allergy Insider, also a great place to check out for more information. There were some questions around testing as well, so we have a lot of great resources on Allergy Insider for how to get tested, what do the tests mean, what about component testing? I know you mentioned that, so certainly check that out. Here's a good question though. I'll take this one. So you mentioned before if there was someone else in the house that had a peanut allergy and had it introduce peanuts to maybe the sibling. There was a question around what if the parent was allergic to either peanut or maybe something else, tree nuts. And we had another question around, what if they have a food allergy to another food? And any thoughts around that? How do you do it safely when you have these other situations around you?
Yeah, so I think that is a question we get a lot at Solid Starts as well, is that, I have a severe peanut allergy and I don't want my baby to have one. And so I'm committed to doing early introduction, but how do I do it and stay safe at the same time? And we do have resources for that. One of the things I would say is lean on your village, right? You are not the only person on the planet who can feed your baby. Maybe you feed them many meals, but somebody else wants to help out and they ask, oh, I want to spend time with baby. How can I help? Maybe grandma feeds the peanut, or dad, or an aunt, or an uncle, or an older teenage sibling takes the responsibility of doing the peanut feeding as a way to bond with baby and also keep you away from the peanut if you are that sensitive that you have trouble being around it or contacting it. But if you yourself are going to do the feeding, it's important to recognize that the risk of experiencing a serious reaction without actually ingesting the peanut is very, very low, even for some of the most sensitive peanut allergic patients. And so you shouldn't necessarily be concerned that just by preparing peanut for your baby or feeding your baby peanut or getting a little bit of it on your hand while you're feeding the baby, that you are going to go into anaphylaxis or experience a serious reaction. And I think that recognition is also very important when it comes to modeling calm, when it comes to how we deal with peanut allergy in our day-to-day lives. That recognition that, what, I'm going to be okay. I'm just not going to eat it. And if it gets on me, I'm going to wash it off and we're just going to move on. It's important. So that's something you can do. You can use disposable utensils. You can make sure that you have moisturized your hands, or if you have eczema on your hands, maybe you want to spoon feed rather than hand feed. So little things you can do to try to minimize your contact. But like I said, definitely lean on your village and see if you can get help with feeding. Sometimes I have some families where dad takes the baby out onto the porch and feeds the baby outside in the nice weather and just gets it over with and takes care of bath time too. So that's one thing. And then Becky, please go ahead and remind me of the second part of that question.
I think you covered it, but I love the lean on your village. So I'm going to steal that one. I think that was we had a couple other comments here. A few people that actually have purchased the bundle said it's fantastic. But again, that giveaway, so check out the Instagram post for that. And if you don't already follow us on Instagram at Allergy Insider and Solid Starts at Solid Starts, please also give Dr. Bajawala a follow on her professional Instagram account at allergist.mommy. So make sure you send some of the love that way. And we're wrapping up our time here. Again, lots of great comments and questions in there. Hopefully we've given you all a lot of fantastic resources. Dr. Bajwala, any closing comments or thoughts that you have from our conversation today?
First of all, thank you so much for having me. I always enjoy having these conversations because I think that spreading the awareness about the value of early allergen introduction is one of the most important things we can do as professionals, because the more people who are aware that this can be helpful, the more people who will actually do it. And it's our job to make you feel comfortable and answer your questions so you can do it without hesitation. Or if there is a reason why you would need additional medical support to move forward with early introduction, we can give you awareness about the tools that are at your disposal, including allergy blood testing, skin testing, oral challenges. All of these things are available to you. So don't be afraid. Lean on your resources, lean on your village, and let's go prevent some food allergies.
Excellent. Make sure you like, comment, share our video to help us spread food allergy awareness. Again, it's Food Allergy Awareness Month. And stay tuned. We have an upcoming hashtag empowered patient panel for our next Ask the Insider. Going to be hosted on our Allergy Insider YouTube channel. So please don't miss that, and we'll see you next time. Thank you all.
Bye-bye.